Bob, I think, has been a pioneer from the very beginning. I think he was, that first wave of epidemiologists in the early 70s who started thinking about epidemiology not only in terms of infectious diseases, which is where it has its roots, but also in the study of chronic diseases. And I would say he's been a pioneer since then.
Bob is the guy who knows where you can find wonderful data. He's been involved in really the landmark studies in epidemiology and aging. I was looking at his CV, his biosketch, and his history goes back to smallpox eradication in the 1970s. He was in Nigeria at the time smallpox was eradicated from West Africa as part of the CDC contingent there. And of course, eradication of smallpox is one of the kind of defining successes of epidemiology and public health. He was at the center of the Women's Health Initiative, the first really big study of the health of women. He was the center of one of the negative events in epidemiology, the evidence from the statistical evidence on hormone replacement therapy suggested it was very positive and had a lot of benefits for women. But when the randomized trials were done, it turned out it was actually quite dangerous and increased cancer rates and so on. And again, whose name is there? Bob Wallace, right at the center of that. And he extended those analyses into all sorts of areas of aging, showing that hormone replacement therapy was actually had some really dark sides.
You know, I think that Bob has kind of evolved from not only preventive medicine, but really looking at prevention related to aging and prevention related to women's health. And then he's also had several side projects looking at bisphosphenols, looking at smoking, looking at other things along those lines. Bob is always challenged by new things, and that's always a good thing. It always keeps your mind fresh and always testing new hypotheses.
Bob has had an incredible role, not only in epidemiology, but also in public health writ large for really the totality of his career. Very generally, it's aging. And aging's a big umbrella, so there's a lot of aspects of that, and including everything from understanding mechanisms of frailty and really providing leadership to the single largest ongoing study of aging in the health and retirement study over many years, and mentoring many collaborators and investigators and junior trainees to really work through that resource, to intervention trials that he's done to prevent falls, prevent fractures. So he's really spanned the gamut in methodology and taken epidemiology of aging from discovery to implementation.
So when I met him, I think it was in London actually, in the early 2000s, he just seemed like such a warm person, so open to debate, so open to discussion, and with incredibly wide interests. I mean, I'd never come across a person whose interests ranged from biomedical issues, preventive medicine, through to issues about financial abuse of older people and aging prisoners and so on. His range of interests is extraordinary, and I think perhaps the secret of Bob is he really cares. He really cares about the patients, and he really cares about preventing unnecessary disease and suffering in them. And I think that's led him to really think deeply about the underlying mechanism. So the other thing that I really got from Bob is a lot of people do statistical models and get answers that look plausible. But Bob thinks about the underlying mechanism, what's actually going on underneath. And quite often, that's quite different from the initial statistical model.
I first met Bob when somebody recommended that I approach him about the possibility of working with me and putting together a grant for HRSA on older adults and chiropractic care. And he was immediately interested in the possibility of joining the team, and spent a lot of time with the other members trying to figure out what the best model was. And in fact, our research design ultimately was based on his recommendation. So we were really excited to have somebody who is so highly respected in the field and so knowledgeable as part of our study team. And since then, we can't hardly imagine having a study without Bob involved, just because he has made such important contributions to the study of chiropractic over the last 12 years or so.
He really is an idea maker. He generates ideas for others to think about. So he really just comes up with something new. And you kind of go, okay, what's Bob thinking about today? Well, if you go down to the printer and you see a paper of an unusual topic, it's usually Bob's. So he likes to read, he likes to think, and he likes to explore stuff. The biggest compliment any faculty member could have is to be a creator, and a creator of thought, knowledge, and getting people to do it. He doesn't necessarily have to do it if he can get other people to do it.
The people that Bob brings with him, I think there are literally hundreds of people that he's mentored over the years. And I think that makes a huge impact on the field as well.
I think there's several of us who've had the unique opportunity to have Bob as our mentor. And the other perspective was we realized that Bob was our mentor, but he also gave us tremendous independence. And we kind of realized that he selected students to be his grad students who were going to be independently successful. So that, one, he may not have had to do a lot of things, but he could just plant seeds and then we would run with it. So, I think that's a unique characteristic that he has, that he can just kind of, you want to think about it this way, and then you do, and you go, okay, well, I'll take it and maybe I'll bend it and shape it a different way, but at least the seed was planted.
It's really hard to kind of sort of capture his persona and why it is that students seek him out, but they do. The smartest students seek him out because they know there's a lot, that he has a lot to offer and a lot of ideas to offer. I think he's got a very welcoming personality. He's not a mushy kind of guy, but he's very open. I think that's the biggest thing. He's just really open to ideas, no matter where they come from and no matter how poorly they're expressed. Sometimes he'll tell them that they better work a little bit on the so what behind that idea. So I just think it's a little bit of that openness and curiosity about ideas, no matter where they're coming from.
I think we've always had enough good students and enough ideas, and as you've heard, enough research infrastructure to give them good things to do and to learn how to, at the PhD level, to learn how to be a research scientist and epidemiologist. So that's really the way it went. I think epidemiology has a great future. It'll be different than it is now, but it's always been different. It has to evolve.